Before we get started, I'd like to introduce Dr. Albert Knapp, the director of our ABA program at Coglip. Dr. Knapp is a highly accomplished clinical psychologist, a board-certified behavior analyst, doctoral, and a registered play therapist supervisor. With more than 18 years of expertise in autism and other developmental challenges, Dr. Knapp has been a leader in creating tailored interventions that make a lasting impact on children and families. It's also my pleasure to introduce Nellie Lai, our ABA clinic manager at Coglip. Nellie is a highly skilled board-certified behavior analyst with over 8 years of experience supporting children with special needs. Her expertise and dedication have made her an invaluable part of our team, helping families and children achieve meaningful progress through individualized care. During today's webinar, Dr. Nab and Nellie will provide a 45 minutes deep dive into ABA, exploring its principles, practical applications, and how it can transform your child's developmental journey. This will be followed by a 15 minutes Q&A session where we'll address your questions. So please remain muted throughout the whole webinar to minimize disruptions. And if you have any questions, feel free to type them in the chat, and our experts will address them during the Q&A session. So thank you for being here, and I'm going to hand it over to Dr. Knapp and Nellie, please.
Hi, thank you everyone for joining us today. We're excited to get started. If you can change to the next slide, this is going to be our agenda. We'll be reviewing some of these core points very briefly. We'll try to be as patient and talk as slow as we can. If we ever talk too fast or if there's any questions, please go ahead and let us know in the chat and we'll try to address it during that time. If not, we can always go back to the chat and review it during the Q&A session at the end. We'll be talking about the introduction to applied behavioral analysis, core principles of ABA, goals of ABA therapy, the ABA process, key techniques in ABA, benefits of ABA for children, how ABA is implemented, parents' role in ABA, potential challenges, as well as conclusions and key takeaway. Can you change to the next slide, Fiona? Okay, so applied behavioral analysis, short acronym is ABA. It's a scientific approach, focuses on understanding and improving the human behavior. ABA is a scientific discipline that uses technique based on the principles of learning and behavior to bring out meaningful changes in behavior. So the purpose in ABA is really grounded in the theory that behavior can be understood and modified by analyzing the relationship between the individual and their environment. It helps individuals, especially those with developmental needs like autism, to develop skills and reduce problematic and unsafe behavior and improve overall functioning. Our goal is really to improve the quality of life for the demographics that we serve. A big foundation of ABA is really learning through reinforcement. In ABA, reinforcement means we're trying to increase a specific behavior. ABA emphasizes positive reinforcement to encourage desirable behaviors while supporting a child to replace complex behaviors that might cause harm to the individuals or others. It's important for us to really highlight that ABA is not a discipline that is purely punishment-based, nor is it a discipline that is purely compliant-based. So what's different about ABA is that it is definitely very data-driven. ABI consists of a whole clinical team who continuously take data and analyze the progress of the child's goals to make informed decisions. All of the interventions and goals are highly individualized and they are tailored to the child's specific needs as well as their challenges. In addition to their needs and challenges, we also encourage parents to participate and be a part of the clinical team so that we can support the individuals in the best way that we can. ABA ABA aims to promote socially significant behaviors. What that means, socially significant behaviors, is what's really important to the child that will help them improve the quality of their lives. Um, it is commonly used to develop communication, social skills, daily living skills. Other areas that we support that we'll discuss a little bit more today includes parent education as well.
So ABA is based on a few core principles. One of the first ones is essentially that all behavior is learned, and that means whether the behavior is positive or negative, since it's learned, it can be unlearned or changed through processes like reinforcement and punishment, and other techniques. ABA always uses what's called the ABC model or the antecedent behavior consequence. It really helps us understand how behaviors occur. So in the ABC model, it's the A, it stands for antecedent. It's always what happens right before the behavior. The behavior is what actually happens, what you can observe and see. And the consequence is what happens after the behavior, and that will typically influence whether behavior will happen again. So a really easy example I like to give is when we're driving a car and we come to a stop sign, visually seeing the stop sign is the antecedent. The behavior is we stop the car, and the consequence typically is we avoid something negative, like a car accident, hitting someone, or running a stop sign, which breaks a rule, essentially. So that's how the ABC model is used. Reinforcement is one of the main teaching modalities. So through positive reinforcement, it strengthens the desired behaviors through rewards or incentives. Very different than a bribe, where we say, if you do this, you get this. It's when you do this, we're going to give you reinforcement for doing the behavior. But it's never set up as if you do this, you get this sort of thing. That's a bribe. And then there's different punishments. Essentially, there's positive and negative positive negative reinforcement. So it's two different ways of going out about reinforcing the behavior. And then for punishment, same thing, we reduce unwanted behaviors by introducing an aversive stimuli towards the behavior. So we don't punish the individual. That's a very important distinction. We only punish the behavior. And all behavior plans always have to have reinforcement. They do not have to have punishment procedures. And as ABA has evolved as a field, there's been a lot less punishment used. And a lot of funding sources, as well as practitioners, agree that punishment is to be used as a last resort. So when we have exhausted all positive protocols and more reinforcement-based strategies, then we go to punishment. And the last kind of principle of ABA is generalization. We want the kiddo to take what's learned in the ABA teaching sessions and generalize it out to outside the session. So in their classroom, with their parents, when they go to different locations, whether it be the park or somewhere else, we want to make the store, Target. We want to make sure that the skills that they're practicing or demonstrating in our one-to-one teaching sessions occur in other locations and with other people as well. So that's what generalization is.
Okay. Goals of ABA therapy. When you kind of dive into the world of ABA, you'll be hearing a lot of these terms. Things like skills acquisition is a major goal. We're teaching new behaviors such as communication, social skills, daily living tasks, and perhaps sometimes even academics. Skills acquisition is really focused on building the child's repertoire for the things that they're able to do independently. Behavior reduction is another big component of ABA. And when we're talking about behavior reduction, we're very specific about decreasing unsafe and challenging behaviors like aggression, self-interest, or tantrums. Okay? We're reducing behaviors by also increasing skills. This is called skills-based treatment. A big goal of ABA is to increase that independence and promoting autonomy by helping individuals learn self-management techniques. And this might include coping strategies too, essentially skills that help them meet their own needs and provide a sense of autonomy to the child. And all of this together, our main goal is to improve the quality of life, whatever that might look like for the child and their families, and ensuring the individual can participate in more meaningful social and community activities in ways that works for them. Our goal is really to be a strong foundation and a starting point for them to grow by themselves.
So we wanted to break down kind of the ABA process, like what it kind of looks like when you're getting involved in treatment. So it always starts with what's called an assessment, typically called a functional behavior assessment, sometimes called an initial treatment assessment. A lot of insurance companies refer to it as like treatment plans. So then we kind of adapted the FBA terminology, functional behavior assessment, to mean like the initial treatment plan. Essentially what it is the BCBA gets a lot of background information on the from the parent or the caregiver. Then they directly observe the child and they probe skills. So they kind of see the child's age. Well, they don't say they get the child's age. And then what they do is they probe those skills that are age appropriate to see what the child can and can't do. And then they use all that data to create a personalized treatment plan. Essentially, we're going to teach the skills that are not there. We're going to find out why the challenging behavior is occurring. So why are there tantrums? Why is there elopement, which is a fancy way of saying running away? Why is there self-injurious behavior? And then we're going to teach replacement behaviors. So we're going to identify what those replacement behaviors are. So if they're running away from demands because they don't want to do it, we would teach a behavior to ask for a break, essentially. And if they were verbal, we would use words. If they were nonverbal, we would use like sign language or pictures to help, that individual communicate. So after the assessment, then we get into the intervention plan. So this is like the meat and potatoes really of the assessment report. It's completely tailored to the individual's needs. It's going to increase all of the skills that were noticed as deficits and strengthen desired behaviors. And that is going to replace the negative or undesirable behaviors with what we call replacement behavior, which is going to be a socially desirable behavior for the individual to do. All of that happens through data collection. So we take data from the moment we say hello to the moment we're done. We're constantly tracking data on everything from the skills to the challenging behavior, as well as parent participation, which is the last point. Parents are integral to success of ABA. You are with your child way more than we are with your child. And it's very important that you not only learn what we're doing, but you practice doing it when we're there so we can make sure you're doing it correctly. And then you continue to do the treatment when we're not there. Because behaviors are going to occur all day long. They're not just going to occur during our sessions, as well as teaching moments will come up all day long. They're not going to only occur during our sessions. So it's really important that the parents are involved in the treatment as well.
So there are so many different types of strategies and techniques and approaches when it comes to teaching your child. We're just going to briefly review some of the technique to introduce a little bit of what ABA is. If you have been introduced to the world of ABA, some of these terms might be familiar to you. Otherwise, they might be just sounds and letters, and that's completely okay. Some key techniques in ABA includes discrete trial training, also known as DTT. DTT is a structured ABA method that breaks down skills into smaller teachable steps. DTT might be some of the most familiar strategies, what parents usually think of when they think of ABA, but this is not the only technique. Other techniques are natural environmental teaching, also known as NET, pivotal response treatment, PRT. Both of these strategies are a more naturalistic way to teach a skill. ABA is very play-based, especially here at Cogley. We prefer NET style or PRT in order to really address some of the goals and address some of the needs the child has. DTT may be a part of it, but it's not all of ABA. NET involves teaching skills in natural, less structured environment, incorporating a child's interest to encourage learning in a more organic way. PRT really focuses on targeting pivotal skills, which can be taught during play also. Other strategies that we utilize include a task analysis. A task analysis is just a fancy way of saying it's a list of instructions. Okay. A task analysis breaks down complex skills into smaller, manageable steps. Task analysis might be utilized to teach things like washing hands. First, the child turns on the water, then wet hands, then put on soap. All of these little components to make a big task is known as a task analysis. And we're utilizing a task analysis to really track and teach these bigger skills that involve multiple steps. Lastly, functional communication training. This is a big component of the replacement behaviors. UpCT teaches individuals to communicate their needs in appropriate ways. As Dr. Knapp was saying, in lieu of hitting or running, they would say, I need a break. And we would reinforce that by providing them with a break. This is manipulating the environment in order to increase the behavior of simply saying, I need a break, instead of hitting, running, screaming, yelling. That is the preferred behavior. Okay, this is an example of what ABA might look like. We're going to play a really short video. One thing you should know in ABA is that it is a health service. We do have to abide by HIPAA rules. This is not a real session. It's simply a role play, but it gives you a little sneak peek of a naturalistic approach to teach skills. In this video, you might see things like prepositions, which means on top, under, in between. You might see things like color cues, red, green, yellow. All of these are really valuable communication skills that can be taught through play, and is usually learned through play.
Right, we're gonna play with the farmhouse.
NET helps clients generalize their learned skills in new environments and situations.
Here, you can have one. What's this?
Pig.
A pig, it's a cow. What's this?
Cow.
Cow, good job. And a cow says,
Oink, oink.
oh, good try. Cow says moo. Cow says, ooh, that's a good cow impression. I love it. Where's our horse gonna go? What does a horse say?
Quack, quack.
Good try. Horse says neigh. What does a horse say?
Neigh.
Good job. Here, put our horse in the barn. On top of the barn, let's put it right here. Good job. And then what's this?
Oink, oink.
It says oink oink, but it's a pig. What's this?
Pig.
Good job. And a pig says,
Oink, oink.
good job. You're so smart. Do you like playing with the farmhouse?
Yes.
Yes? Okay. Good. Oh, what's in there? What's that? Uh-oh, it's
Goat.
stuck. A goat close. It's a sheep. What is this?
Sheep.
And a sheep goes
Neigh.
close back.
Back.
Good. A sheep goes.
Back.
Good job. Do you want to play with the blocks?
Yes.
Okay, let's play with the blocks.
As a therapist, it is very important to constantly be narrating to the client what you both are doing. This will help encourage expressive language and tacting skills.
Should we make a tall tower?
Giraffe.
A giraffe? A tall tower like a giraffe?
Yes.
Okay, that's
All right. We're just gonna watch that little bit and continue on. As you can see in the video, there are a lot of skills that are being taught. Even in that minute and a half that we watched, you saw that the child was tacting or labeling animals. You saw that the BT was trying to teach prepositions on top, in the middle, inside. You see that the BT was trying to teach intraverbal or fill in the blank. What sound does the cow make? Ba. No, it goes moo. In that example, you see error correction. Yes, you can have the video link. Let me put that in the chat real quick so that you can watch a little bit more on your own. But there's a lot of skills that are being taught even in that short minute and a half. And another thing that you see is that repetition, right? They're providing multiple opportunities for the child to learn this skill and really ensuring that the child is building fluency. Once the child is building fluency and we're tracking that, we then build upon that skill and teach other things. In ABA, we have what is called the 7 dimensions of ABA. It is based on 7 core concepts known as the 7 dimensions. And these 7 dimensions are heavily research-based, and it really guides meaningful treatment. The dimensions include generalization, which Dr. Albert has touched on. It is teaching various skills that generalize across settings and situations. We're making sure we're tracking data to make sure it's effective, ensuring the therapy is effective in producing meaningful and lasting change in behavior. It is also technological, meaning we're describing the therapy in a way that can be replicated by others. It is applied, focused on socially significant behaviors that have practical importance to the child's life, and conceptually systematic. We're utilizing principles and strategies derived from the science of behavior analysis. It is also analytic. We're collecting data and conducting ongoing assessment to determine if what we're doing works. Otherwise, we can make changes to the intervention plan and take data based on what is working. Lastly, it's behavioral observation, directly observing and measuring behaviors to guide treatment decision. My role as a BCBA is to provide that observation and do all of these things and ensure that your child continues to learn and grow with us. You're muted.
Thank you, Natalie. There are lots of benefits for ABA for children, and we wanted to pull out some of the big ones. Essentially, ABA is one of the most proven effective treatments for children, well, individuals, not just children, individuals with autism spectrum disorder. There's been studies since the 1970s that document its effectiveness, and it is, like I said, the most research-supported treatment. The improvements that are often substantial include communication, social interaction, and adaptive behaviors. And these skills really aim to enhance their ability to navigate daily life, learn, build relationships, become more independent. And then all of the goals, again, are individualized, and they're backed by data and continuous monitoring. So because of all the data that are used in ABA, we can very easily see, is something working? And when something's not working, we use that data to change it, which allows us to be really effective when after maybe 2 days, maybe 3 days of session, we go, you know what? This isn't working. Like, this goal is not appropriate. The kiddo is not learning. Let's go like kind of one step below, so that way we can get that skill built up and then go back to this goal. ABA also empowers families and caregivers. So as I mentioned earlier, parent training is really important, and it's a crucial part of ABA therapy. The therapist and the BCBA will equip the families with effective tools to support their loved ones. We do take a family-centered approach, and that improves outcomes because the family or the parents and siblings, if they're involved in the treatment and they're motivated and they like what we're doing, they're going to do it at home, and then their child's going to learn the skills faster. So really empowering the family and caregivers to move the treatment along as well. That helps with generalization, and then also ensures that the child gets what's called consistent reinforcement, meaning that the kiddo is going to get reinforced for the behavior, whether the treatment team is there or not, and that's going to strengthen the behavior and make it happen more often. It's accessible across all life stages. So as part of the assessment, we always do what's called a developmental assessment, and we really get a sense for where the child is developmentally, and the goals and what treatment looks like changes with the age of the child. While for young children, we do lots of very play-based methodology. We could take those same methods and do it with a 17-year-old. It won't be as play-based, but we can use those same principles, those same interventions, and be able to teach them. So no matter what developmental or chronological age the child's at, we use ABA across all the lifespans. So from early language skills all the way to independent living and job training, all stages of life, essentially, we can work on. And then lastly, it does enhance the quality of life. It does allow the individual essentially greater independence. It's that letting them be meaningful participants in their families and their communities. A lot of times with good ABA intervention, individuals can get a job when they get older, so they can have their own independence. They can make a living. They could do something that brings them joy. And all of that comes from really good treatment with ABA when they're younger.
Okay, so how is ABA implemented? When you join a organization and receiving services, you have a clinical team. The ABA therapy team typically consists of board certified B analysts who will be overseeing your case. They are designing and providing training to the RBTs, also known as registered behavioral technicians, who follow the intervention plan and deliver the one-on-one service. ABA can be in clinic, in home, community-based. Therapy, one of the goals for us is to generalize across different settings. So you'll see that ABA is introduced in these different settings, so the skills are generalized. Session structure. Sessions can vary in length and frequency. It is very, very individualized based on the assessment and the child's needs. Typically, it occurs at 2 to 5 times a week with a one-on-one session with an RBT. Hours recommended daily can range from 2 hours and in some cases up to 8 hours, depending on a variety of factors, including severity, needs, as well as age and settings. Collaboration with school is very important. ABA program may be integrated into the child's education setting to ensure consistency across the environment. So how do I know what setting is appropriate for my kid? This is highly dependent on the child's needs, and there are several factors that you do have to consider. A child's skill they currently have and skills they need to acquire, child's complex behaviors that they engage in. Complex behavior means perhaps safe or unsafe or dangerous behaviors they engage in, or even some stimmings. You have to consider your child's needs based on their age, and you have to consider your funding source and their specific requirements. You also should consider your family's preference and values, and you should consider what accessibility needs you guys have. To explain that a little bit more, some families might not be able to commit to home sessions because they don't have the space for it. Some families may not be able to get services in the clinic because they don't have transportation. Some families may not have the ability to get services inside the school because there's no funding for it and their insurance perhaps do not pay for it. Skills that they currently have and skills they need to acquire is a big one. For example, in a clinic setting, perhaps that might not be suitable for a child that is super young that might require more skills like potty training. That might be something better targeted in the home. If your child engages in severe behavior, such as aggression, the clinic setting or community setting might not be the best right now because we want to make sure everyone is safe involved.
Yeah, and all the parent slides today, and and so here and we talk about a little bit more again about the parent's role. This is again very, very important. So consistency, reinforcing the positive behaviors at home, along with the ones that the therapist is reinforcing or the behavior tech treatment team, is going to help have the child learn those skills faster. During parent training, you will learn exactly what to do, particularly in challenging behavior situations, because it is not necessarily what you first think to do as a parent when a challenging behavior occurs. So we teach you what to do. A really common example is sometimes kids would cry for attention. So as loving parents, you hear your child cry, and you would go over to your child, say, what's wrong? How can I help you? But if the child is crying purely for attention, we would teach you how to ignore that behavior and at what point to provide that attention, usually when the child does something more socially appropriate. And that we can practice and role play through in parent training. Monitoring progress. So yes, we take a lot of data when we are with the child, but we also use what you report as data as well. So if you're saying that, my child just like yells and screams at Target all the time, we would want to go to Target one day and we would want to like figure out like what's going on with that. And that's data from you. That's your narrative report of what's going on with your child. So we want to encourage regular communication. You want to share with us any setbacks you may have noticed or any improvements you may have noticed. That's really something important. So you guys are able to share progress with us just by observing and being with your child. And then lastly, ABA is always individualized, so we can get as individualized as the parent needs. Some parents really need a lot of modeling and guided practice in order to implement the strategies, and the BCBA can do that. They can do that as part of the parent training. Other parents just need an explanation, and they understand it, and they can go forth and do it on their own. Either way, the parent and the treatment team collaborate and they talk about what they need in their support, and then they get that individualized support from the clinical team.
Okay. Potential challenges in ABA. So, of course, there's going to be challenges with the services because it is a huge time commitment. ABA therapy can require significant time and effort, particularly in the beginning. You're having to invest time spending with the BCBA during the initial intake process. All of the information we receive is from you, in addition to spending time with your child. Parent education is also a time commitment, as well as, perhaps spending time and being present during session if you're receiving home sessions. Behavioral resistance is another potential challenge in ABA. Some children may initially resist or show frustration with a structured approach. This is something new to them, something novel, perhaps. They're not necessarily used to trying to do hard things, and perhaps they're not necessarily used to having demands placed on them. Behavioral resistance is very normal when you're learning new things or when you're having to unlearn things. Cost and accessibility is another potential challenge, as ABA can be very expensive, and access to qualified therapists may be really based on location. Perhaps you live in an area where ABA services is not commonly utilized, and there's just not a lot of quality service provider around you, and you don't have the resources to gain access otherwise. Emotional impact. This is a big one. Parent might experience frustration or emotional exhaustion. It's tiring being a parent. It's more tiring being a parent with a neurodiverse child. Support groups and therapists' involvement can really help. It's important to build community. Your ABA service provider is not only just your clinical team. We are also a source for you to lean on. But nonetheless, finding community outside of that is also very important and encouraged, especially if you have access to professional help. Supply and demand. There is a large need and a lack of provider. It also may take some time to find a team that fits with your family's needs. It's not a one size fit all. Just because you have access to ABA in this moment doesn't necessarily mean that's the right fit for you. We all have different personalities. We all have people that we mesh and gel with better. So considering your family's needs and values, as well as what you look for in a service provider, is also really important.
So some conclusions and key takeaways before we get to the question and answer is the long-term benefits, because we talked a lot about the commitment, and it is a big time commitment, and it is a monetary commitment, and it is something that doesn't just get resolved in a month's time. The treatment length could be sometimes a couple of years. However, the long-term benefits outweigh what we would call like the response effort, what you put into it. The long-term benefits are significant improvements in child behavior, communication, and overall life skills. And again, ABA is the most research-supported intervention currently for children with autism. It's individualized. Every child is unique, therefore every ABA treatment plan is different and flexible to the needs of the individual as well as to the family. I don't think we went through this yet, but when we're developing the goal in the initial assessment, the BCBA will ask the parent, like, what's important to them? What would they like to see their child do? What would they like to see their child learn? So going on to the next point, the collaboration between parent and therapist, or really parent and treatment team, is really crucial to achieving success. Because if you say, I want you to work on, language and social skills, and we say, well, we feel like teaching your kid just colors and numbers, like that's not going to be a good fit. So you need to make sure that we collaborate and we work together and we're targeting skills that are important to the family, as well as skills that are developmentally appropriate at the same time. So that collaboration piece is really key for treatment to be successful.
So Cogley's approach to ABA. Cogley goes beyond traditional therapy models by embracing diversity and fostering a supportive community for neurodiverse families. Our model is rooted in a neuro-affirming, assent-based, strength-based philosophy, which means we really focus on a child's individual existing skills and key developmental skills rather than solely addressing deficits. We prioritize participation as opposed to compliance. Utilizing naturalistic and skill-based treatment as well as practical functional analysis by the great Dr. Greg Hanley, who is a prominent figure in the field of behavioral analysis. He really emphasizes the importance of safety, televisibility, which means, you are behaving in a way that you're not ashamed of to be shown on TV, and rapport building. We help children learn in a way that feels authentic and meaningful to them, allowing the development of skills that extends beyond just the clinic setting into their daily lives. The ultimate goal really is to increase joy and quality of life for kids and their families. I know you hear us say this a lot. Some of the things we keep on harping is quality of life, joy, parent participation, but it really reflects to what we believe in and the service that I personally try to deliver. In our clinic, we're very proud of what it is that we've built here and what it is that we do. Okay.
Oh.
Go ahead, Dr. Albert. Take it away.
We spent a lot of time today talking about our ABA therapy services, and we do have them across all of our clinics. So in Irvine, we do an in-clinic only program right now. In San Jose, we do in-clinic, and then in the Fremont area, we have home-based services. In Walnut, we can do in-clinic and home, and then we are in the process of opening up a location in Beverly Hills to be able to service that area. But in addition to ABA, Cogley is really awesome, and they do other therapy that is like great to also help children with autism and other neurodevelopmental needs like ADHD. One of the most popular therapies that we do here is HFS cognitive training. It also is research supported, which is great. So it's an innovative AI-powered drug-free intervention for children and adolescents with autism or ADHD or other developmental and neurodevelopmental challenges. And the data supports, or the research supports, that it improves focus, emotional regulation, behavior, and communication. What's great about HFS training is you often see results a lot faster than you would in ABA treatment. You can see results in as little as 40 sessions, which could be 20 weeks, because you could do HFS 2 to 3 times a week, and it's only an hour each time. So it is a lot less time consuming. Unfortunately, right now, insurance does not fund for HFS cognitive training, so it is privately paid. But if your child is a child of the regional center and you can access self-determination funding or the self-determination program, whatever your regional center calls it, HFS is an approved expenditure for self-determination program or self-determination funding. And then they also do a really awesome assessment called the BCAT assessment. I actually use this in practice as well, and it's awesome. It's a virtual reality headset that kids would wear, and it stimulates them being in a classroom. So like when you wear it, you see a whiteboard, you're sitting at a desk, and then for about 14 and a half minutes, there's common classroom distractions that go on, like PA systems, kids getting up to walking around, coughing, sneezing, a bird chirping outside, pencils dropping, things that happen in a classroom. And at that same time, the child needs to block all that out and then indicate on like the little hand paddles, like when a certain letter flashes on the whiteboard, and it flashes at different rates and whatnot, so they have to attend. So they have to attend to what's going on, block out the distractions, and also control their impulses by like only pressing the button when they're supposed to. And what's great, because it's a virtuality environment, we can track their motions of where they're looking, where their head is moving, where their hands are going. I did one assessment of this, and the kid decided to get off the chair like upside down, and so like the data report showed the kid was moving all around. But it's a really great assessment tool for assessing most of the conditions similar to ADHD. It doesn't diagnose ADHD, but it looks at a lot of the psychology. So with the VCAT assessment, going to a mental health professional, that can help provide data to support a diagnosis of ADHD. But the VCAT does not diagnose. It just looks at symptoms that would be similar. And then if you wanted to get in contact with us, we have lots of different ways. Our toll-free number goes to a main kind of switchboard. So whatever location you're interested in, if you call the toll-free number, you can reach wherever you need to reach. We constantly monitor email. So if email is more your thing, you can send us an email. We also have a lot of Chinese-speaking staff members. So if you wanted to put the email in Chinese, we can get that translated and respond back to you as well. We have a lot of good information on our website. And then our main location is in the Irvine Center. So that's where most of us are. But again, we have those other locations, and we are happy to service you wherever you may be.